How can you invest in continence?
Making active choices to eat more fibre, as boring as that sounds, could be easy, like having some veggies and dip at beer o'clock instead of chips or cheese.
Drinking a good amount of water each day, maybe fewer coffees and soft drinks. I'm not going to suggest you cut down on alcohol, but you may want to think about it.
Exercise is important, like walking for half an hour a day.
And your pelvic floor, one set of muscles that directly affect your continence, not just for women, but benefit men as well.
I'm not planning to spend my retirement anywhere but at home.
And that trip to Europe we booked.
Invest in continence. Visit continence.org.au or call the National Continence Helpline.
Good afternoon, everyone, and welcome to today's webinar, the fourth in our Healthy Habits webinars for World Continence Week. My name is Anne Hudson, and I'm the Health Promotion Manager for the Continence Foundation of Australia. Today's webinar is titled Good Toilet Habits, the Nuts and Bolts of Bladder and Bowel Health. As we start today, I'd like to acknowledge and pay respect to the traditional custodians of the land on which we meet today. I'd also like to pay respects to the elders, both past and present, of all Australia's Indigenous peoples. So welcome everyone, and as usual, before we start, there's a little bit of housekeeping that we need to go through today, so to help you in participating in today's event. So if you're joining us via Zoom at any time during the webinar, you'll have the opportunity to submit your questions to our presenters. And to do so, just type your question at the bottom of the screen at the arrow Q&A at the bottom of the control panel. So as time allows, we will try to address all your questions, and especially those of a more general nature. Any unanswered questions will be passed on, and we'll do our best to answer them on Friday at the Q&A webinar, where tomorrow at 1 o'clock, we will have an expert panel of a physiotherapist, a continence nurse, and a geriatrician. So please make sure you join us tomorrow, and you can have your questions answered then. For people watching us through Facebook live stream, unfortunately, you will be unable to interact in quite the same way, but you can still send through your questions. I do recommend that if you have any questions of a personal nature, we encourage you to call our National Continence Helpline on 1800 33 0066. We will be recording the webinar, and it will be available on demand on both Zoom and Facebook for the duration of this week, World Continence Week. After that, you'll be able to find us on the YouTube channel. So welcome, Meryl, and thank you so much for joining us. Meryl is our guest speaker today, and Meryl is a continence nurse advisor with the Continence Foundation of Australia. She's one of the many advisors we have who support people when they call our helpline. Meryl has worked in acute aged care and dementia care, and also worked clinically at the Western Health as in the continence service as a continence nurse advisor. Her background and interest is women's health, dating right back to when she started as a midwife in the delivery suite, leading to her interest in continence. She then began working at the Royal Women's Hospital in Melbourne at the Urogynecology Department, and went on from there to complete her continence diploma. We welcome you, Meryl, and thank you so much for joining us today and sharing all your years of experience. So throughout this week, we've been asking you to invest in your continence. Why, may you ask? I don't leak, I'm not incontinent, I don't think I'm incontinent, but, well, we want you to stay that way and make sure that you stay continent, and encourage you to adopt some easily healthy habits that can help with your bladder and bowel health. So Meryl, you've had a long history in incontinence. How long have you been working in incontinence?
I've been working in the area of incontinence for 15 years at the National Continence Helpline, and as Anne said, my other area of interest led me to continence service. The most important thing is that we rarely hear people talking about incontinence. It's very common, but it's not, we don't consider it normal. So the involuntary loss of urine or fecal matter is frighteningly common, but it's something that's very private that people don't talk about. So 1 in 4 Australians report that they have issues of incontinence. 1 in 3 women who've ever had a baby wet themselves, and 1 in 10 men, usually following prostate issues. But the good news is that people can often unaware, for example, that the appropriate medical interventions could treat or better manage their condition. So it's important that people talk about the issues they're having and seek help. And the sooner they seek help, the better the outcome.
So Meryl, what are the signs of a healthy bladder?
So the signs of a healthy bladder is that it empties when it's full, generally 4 to 6 times per day. It tells you when it is full and gives you enough time to get to the toilet. You may wake up once at night or twice if you're over 65. And importantly, that you don't get into the habit of going to the toilet just in case. Try and go only when the bladder is full. So generally speaking, we get the first sensation around 200 to 300 mils, and a good bladder capacity for a healthy bladder is between 400 and 600 mils.
So Meryl, why then is it important for people to completely empty their bladder when they're going to the toilet?
So the reason that we suggest that people try and completely empty their bladder is that there is increased risk of urinary tract infection if there's urine left behind. This may be because they have, for men, that they have prostate disease, and the enlarged prostate is not allowing them to empty the bladder fully. So you get a full sensation sooner. For women, often it is with prolapse. So you might have a small residual left behind. So learning how to empty the bladder is important. The position that we sit in is important, and we'll go through that a little bit later.
So are there any tricks people can do, or is there any advice you can give to help people empty their bladder when they're sitting on the toilet?
Right, so often we suggest that we use a little step stool so that we can rest our feet on the little step. We lean forward with the back straight, elbows on the knees. That changes the angle that we empty, less strain on the pelvic floor, and allows us to empty more fully. Because women sit down to pass urine, sometimes they might stand up and then sit down again. We call that double voiding. For men, if they're having issues trying to empty the bladder, sometimes we might suggest that they even sit down to pass urine to empty their bladder more efficiently.
Now, we've actually just did a poll earlier and asked you how often you get up at night to go to the toilet. So let's have a look at our results. Okay, so well, the majority of our people are saying 48% go once during the night, which is great. 23% have said twice a night, 8% three plus, and those fortunate 23% have actually said they don't get up during the night at all. So Meryl, for those people who are getting up more frequently, what can they do about that?
All right, so for some people, just with the aging process, it's not uncommon that you would get up more frequently at night, possibly because you're actually making more urine at night than you are during the day. So it's the volume that wakes you. So that can be exacerbated by certain medical conditions, for example, diabetes or sleep apnea or prostate issues. So it's best that you actually speak to your GP and have that symptom treated and managed.
You also mentioned about not going just in case. And you hear people getting into that habit of saying, oh, I'm just going out, I just need to go to the toilet. Or how many times have we said to our children, right, we're getting in the car going all the way to Melbourne, everyone goes to the toilet. So what are the pitfalls in going just in case?
All right, so when you're going just in case, you're going when your bladder sensation is not telling you that you need to go. So, for example, if you're going to leave the house, say at 9 a.m. and you went at 8:30 a.m., unless you've had a huge drink, you really don't need to go a second time. The other thing is that if you get the sensation to go at 8:30, maybe you could hold on till just before you leave the house so that you're not going twice, you're only going once.
Yeah.
So the holding on ability improves, and that helps you to maintain a healthy bladder capacity.
Now, we've just had a question come in, or it's actually a mixture of question statement. They said, I can't hold. As soon as I need to go to the toilet, I have to go straight away. Sometimes I even leak when I reach the toilet. Is that normal?
Okay, so it's not normal, but it's very common. That urgency is a sudden and strong need to pass urine. So urge incontinence, sudden and strong need to pass urine before you manage to get to the toilet. You may also hear it referred to as an overactive bladder. And if you have overactive bladder, the bladder may feel fuller than it actually is. So this means that the bladder contracts too early when it's not yet very full, and not when you want to. So this can make you suddenly need the toilet perhaps and leak before you get to the toilet. So often if you experience urge incontinence, well, you always also have frequency to pass urine, and you may wake several times at night to get up and go to the toilet. And it's more common for men to experience urge incontinence, and with women, often that sensation of urgency occurs after menopause. So the pelvic floor muscle becomes thinner, there's less estrogen there, and that sensation to go to the toilet more frequently. So you can have urgency in overactive bladder without actually leaking, and it's still a symptom, it still needs management and treatment, and you should speak with your GP about that.
So there is quite a few different types of incontinence, and yesterday during the pelvic floor session, our physio Annabelle mentioned stress incontinence.
So stress incontinence is when you leak urine during either physical activity, laughing, coughing, sneezing, lifting, or when you bend or go to stand up. And it's common with a weak pelvic floor, which can make it worse, and you should seek advice to have improvement. It often is exacerbated if you have chronic medical conditions, for example, asthma, diabetes, and constipation can also give you that that extra pressure in the pelvic floor and straining to have to pass a stool. The stress incontinence is common. Stress incontinence is most common in younger women, particularly sort of after childbirth and with menopause. And often too with men post-prostate surgery. It's a common symptom for men post-surgery to have that stress leakage. So that can take 6 to 12 months for improvement. And men do have a pelvic floor, and so men and women do need to increase that pelvic more strength to give them more control.
I'm glad you actually mentioned that, Meryl, because yes, some men don't realise they do have a pelvic floor. And so Annabelle mentioned yesterday about the importance of keeping our pelvic floor healthy and strong. And so if you would like to know how to do some pelvic floor exercises or how to find your pelvic floor, go online and look at Wednesday's webinar. And Annabelle goes through the techniques of how to find your pelvic floor and how to exercise that pelvic floor anytime, anywhere during the day without people even realising it. So continuing, Meryl, with the other different forms of incontinence.
All right, so with overflow incontinence, it's an involuntary release of urine due to weak bladder muscle or a blockage when the bladder becomes overly full, even though the person doesn't feel a sensation of urge to empty the bladder. So that's more common with men with prostate disease and or prolapse, or Yeah, that's probably the easiest thing to think about.
Yeah.
So, yeah, so this condition can often be treated, although if left untreated, there can be serious consequences, and it's strongly advised that you speak to your GP about that. Acute sudden inability to pass urine, quite painful as the bladder becomes increasingly stretched, and you should go straight to your doctor. It's not uncommon with to go into retention with prostate, enlarged prostate, and you would need to have your bladder drained. So, but for chronic long-term, overflow happens gradually over a number of months or years, and you may be unaware that it's happening. So it may develop symptoms such as having to pass urine more frequently, straining to pass urine, an intermittent stream, or never feeling like you've completely emptied your bladder.
So not everyone, in terms of incontinence, some people actually are very aware of the need to go to the toilet, but there are other things that are stopping them to be able to get there.
So generally speaking, we call that functional incontinence. So it's not necessarily the bladder that's the issue. It's the fact that that lack of mobility or reduced mobility with conditions like arthritis or Parkinson's disease, that where their ability to make it to the toilet is quickly and safely is decreased. Removing or replacing clothing, so that, you know, for men who are used to having a zip and button and belt, they may need to look at pull-on trousers so that it gives them easier access to the toilet. And you've got to be sitting safely on the toilet. So for some people that means that you have to have a toilet seat, an overseat, so that they can sit more easily. And also too, I mean, you can see that there are bottles there as well. And so sometimes, especially for men, it's an easier way of managing to empty the bladder without having to rush off to the toilet. So seeking advice about what's the appropriate way of helping you manage to get to the toilet is another way of looking at the best way of functioning.
So often people say, oh, you can tell how healthy your bladder is by looking at the colour of your urine. So what sort of, I mean, what are the telltale signs in when people are looking at the colour and if it's too dark or too light?
So what we normally suggest is that you drink at least 6 to 8 drinks in a day, so 1.5 to 2 litres of fluid, and it's a combination of fluid. It doesn't have to be water plus all of your other fluid. So it depends on, sometimes on the time of year, whether it's winter or summer. Obviously you need to drink a bit more when it's when the weather's hot. The urine should be pale, sort of straw coloured, and that shows that you're hydrated. If you're mildly dehydrated, it might be that paler colour around 3, 4, and when it's really quite dark, it's dehydrated and you need to actually increase your fluid intake. So, but the other thing you have to remember too is that a lot of people take vitamins now, and vitamin B will make your urine darker. So even if you're well hydrated, the colour of your urine does change in that set of circumstances.
Another question that has arrived in today, it says, I just leak a little bit now and then, not all the time, just occasionally. Is this okay?
No, it's still the same. Any leakage is not normal, whether it's once a day, once a week, once a month, and investigating it so that it doesn't occur at all is really important. So the principles of eating well and drinking well and pelvic flooring management is the best way of managing that symptom before it becomes worse.
It's interesting, Meryl, because when people think of incontinence, they always think of urinating. They never think of the bowel and bowel incontinence, or, you know, the inability to control their bowel movement or even pass wind. So what are the signs of a healthy bowel?
So the signs of a healthy bowel The stools should be soft and easy to pass without strain, that you're able to empty your bowel completely, that you have a routine of going regularly. So for the majority of people, it'd be first thing in the morning. As soon as you get up, you start moving around, you have breakfast. It stimulates the gut to go in the morning, but not everyone's the same. So some people go in the morning, some people at night, some people, and generally it's anything from 3 times a day to every few days, so long as it's soft and easy to pass. So everyone is different and we have different ways of managing things. Most importantly, you shouldn't need to rush to the toilet or get to the toilet on time. When it's a normal stool, it's easier to manage.
So
So
we'll
we'll
talk
go
about
through that.
normal stool. What does a normal stool look like then?
So your stools should look as a type 3 or 4 stool. So soft sausage, it can have a few cracks in it, but it's soft, easy to pass, and you feel like you've emptied your bowel properly once you've completed it. Type 1 and 2 stools, well, that indicates, it's an indication of constipation. So you can still be constipated even if you're going daily. So then you need to look at maybe increasing your fluid volume, changing some of your dietary habits, increasing some fiber into your diet so that it isn't sitting in your bowel for longer. The longer it stays in your bowel, the drier it becomes, the more difficult it is to pass. And then for types 5 to 7, they're looser stools. The majority of people can cope with having a looser stool. It just depends on how the strength of your pelvic floor. It may be an indication that there are other underlying issues like dietary issues that need to be addressed. So if you're constipated or have a loose stool, you should be speaking with your GP about that and getting referred to an appropriate service to get management and treatment.
Meryl, you actually mentioned earlier on about there is an ideal position on the toilet that help with emptying your bladder. So does that also account and apply to when you're trying to empty
your bowel? Yes, it certainly does. So we suggest the little step stool and the seated position, whether it's for bladder or bowel, and emptying appropriately. Because if you're in that position, it helps relax the pelvic floor, softens the abdomen so that you can empty more efficiently and there's less strain on the pelvic floor, creating more issues. So
that position therefore will help, especially if people are constipated, and helps them stop straining.
Yes, yeah. And the other thing is not holding your breath while you're trying to have a bowel action, because that doesn't actually improve the situation. You can't, the toilet steps are available. Generally, if you need any advice, might be wise to speak to the National Continence Help, the girls on the National Continence Helpline, to see where might be appropriate for you to purchase one of those stools, because they're a very good tool.
Meryl, a question was asked on Tuesday during our exercise, talking about staying active. And the person had stated that when they get up in the morning, they go out walking or for a run in the morning, and they find when they're out there, they actually get the urge to pass a bowel motion, and it comes very quickly and quite urgently. And the only thing is they're not near a toilet and they're out running in the park down the road. So is there any advice you can give to somebody who is out and about and they're all of a sudden they've got that urge to go to the toilet?
All right, so it is important. Yeah, it is important to maintain a good pelvic floor, doing your pelvic muscle exercises, strengthening that muscle. It may even mean that you need to delay actually going for your walk or your run until you've actually had a bowel action. So you might have to change your routine slightly to accommodate the circumstances. Yeah, that's probably the easiest way to manage.
So Meryl, in terms of your last piece of advice, what for anyone who says, well, yes, when I'm out running, I get that urge, or I just have a little bit, or I can't hold, or it's just occasionally I have a little leak into my pants, or they've noticed any changes. What's your final piece of advice for people if they notice anything?
All right. The most important thing that we all need to remember is that incontinence is not normal at any age, and that there is help available. In fact, most cases can be managed, treated, and cured. So speak to your doctor or to your continence nurse advisor on the National Continence Helpline. Our number is 1800 33 0066, and they can help to determine the most suitable health professional or service provider to meet your needs.
So in addition to our helpline, the Continence Foundation also has numerous resources that people can actually order online. You download, you can phone up the Continence Helpline, order it through our continence nurses, or order online. And we have a whole multitude of resources. They come in 29 different languages. We have resources for men and for women, for Aboriginal and Torres Strait Islanders. We also have easy English resources, and they're resources that are majority very easy language and have a lot of pictures in them to make them very easy to understand. Of course, helping also with people whose English isn't as good if they can't access the language ones. You will find those resources on our website at www.continence.org.au, and there's lots of stories and information on all aspects of continence. So I suppose in terms of summing up for today, during the week, we've actually said, invest in your continence, think about those 5 healthy habits, and we can't change everything all at once, and just changing one thing in your day, in your week is going to help. So remember, those healthy habits are stay active, and it doesn't mean going to the gym, it just means add up all those bits of exercise and the incidental exercises that you're doing during the week. Eat well, lots of fibre and lots to drink, getting plenty of fluids during the day, and exercise your pelvic floor. And as we said, you can do it anytime, anywhere without people knowing it. And from today's webinar, practice good toilet habits. Any questions on any of those? Again, we remind you that our helpline, 1800 33 0066, our nurses are there to help you with any of your questions. And also, if you're a health professional and you need advice or some resources for your patients, the helpline staff are there to support you as well.